Side effects may or may not happen. Most are mild and manageable if they do occur. Knowing in advance of treatment what might happen and what to look out for can help you to prepare for and maybe even prevent side effects happening. For example, taking anti-sickness medication before treatment-associated nausea occurs. However, moderate to severe side effects may lead to an adjustment in treatment, such as reduced dose or a decision to stop. Dependent on the frequency and severity of side effects, a treatment may have to stop, either temporarily, a treatment break, or permanently, especially if the risks of harm to your overall health start to outweigh any potential benefits of treatment. However, consequences of treatment may be less avoidable. This may be due to treatment-related changes of bodily function. For example, short bowel syndrome following small bowel surgery. The degree of possible normal function recovery will depend upon how much small bowel, jejunum ileum, is removed at surgery. The average adult small bowel is about 600 centimeters or 19 foot long, and our bodies can usually adapt well to having up to around 50% of this removed. However, SBS can occur in adults who may be left with less than 200 centimeters of combined jejunum ileum after surgery. Example 2. Treatment-induced menopause can be caused or related to a number of treatments, including surgery that removes both ovaries, some chemotherapy drugs, and both internal and external radiation-based therapy to the pelvis. Removal of the ovaries leads to acute, permanent treatment-induced menopause. However, menopause related to non-surgical therapies, where the ovaries remain in place, may be temporary, depending on your age, the chemotherapy used, the number and dose of chemo or radiotherapy treatment cycles, the specific area of the body targeted by radiation, and/or length of treatment. You may find it easier to deal with side effects and/or consequences of treatment if you are able to talk them through with your specialist nurse or team before treatment happens. This allows you to gather the information you may need to manage expectations of care and prepare yourself physically and mentally, accessing any additional support you may need. Having a strategy or plan in place alongside point of contact details for your specialist nurse and treatment team, and any medications or resources that may be useful in managing symptoms can help you regain and maintain control of a situation that may initially seem beyond it. If you notice a change or don't feel well during treatment, it may be tempting to ignore it or not mention it. You may decide to wait a few days or even weeks to see if things improve. This might be because you are worried that if you do highlight any changes or side effects, your team may decide to stop treatment. Alternatively, you may decide that you would rather stop treatment. The sooner your team knows what is happening and how you are feeling, the sooner they can offer support to deal with any changes or decisions this may bring about. Please be reassured that unless treatment has become more harmful than helpful, this does not always mean you may have to stop treatment, unless you choose to do so. You have that choice. Changes or new symptoms may not always be caused by your treatment. Neuroendocrine cancer itself can cause alterations in health over time, and other unrelated health issues may occur. Good communication between you, your team, and GP can help ensure you have access to the right care for you.